Let me ask you something. You're getting dressed in the morning. You glance in the mirror, and there it is, a tiny, fleshy bump on your neck. Or maybe a few of them. Maybe they've been there for years. You've ignored them, you've Googled them at midnight, you've maybe even tried to get rid of them yourself, and nothing worked, or it got worse, or you just gave up and started wearing turtlenecks in July. Here's what nobody tells you. The reason most people fail to get rid of these things isn't because the solution is complicated. It's because they never understood what they were actually looking at in the first place. They were solving the wrong problem entirely. Today, I'm going to fix that. I'm going to show you what these growths actually are, why your body is making them, what the popular removal methods do to your skin behind closed doors, and what actually works, broken down so clearly that by the end of this video, you'll know more about your own skin than most people learn in a lifetime of dealing with this. Stay with me, because the information in the next 15 minutes is going to change how you think about your skin forever. Here's where almost everyone goes wrong before they even start. They assume that any small bump, any little tag, any fleshy growth on the skin is the same thing. They're not. And treating them the same way is exactly why people end up with infections, scars, and the same problem coming back a month later. Think of your skin like a neighborhood. Different residents cause different problems. You wouldn't call an exterminator for a plumbing issue. Same logic applies here. The first resident is the wart. A wart is an infection. Full stop. There's a virus called HPV, human papillomavirus, and before you panic, understand this. There are over 200 strains of it, and the ones that cause little skin warts are almost entirely harmless. Most adults have been exposed at some point. The virus slips in through tiny cracks in your skin, a small cut, a scrape, the microscopic damage from walking barefoot on a wet gym floor, and once inside, it hijacks your skin cells and tells them to multiply like crazy. That uncontrolled multiplication is the wart you see. You can recognize one because it fights back when you touch it. It's firm. It feels rough, almost gritty, like touching sandpaper that grew on your body. If you look closely, and you'll need good light for this, you might see tiny black dots scattered inside it. People often think those are roots going deep into the skin. They're not. They're clotted blood vessels that the wart hijacked to feed itself. Poetic in a disturbing way. Warts also have a preference for location. Hands, fingers, the edges of fingernails, the bottom of feet. That's where they live. And because they're viral, they can spread to other parts of your own body if you pick at them, or to other people through direct skin contact or shared surfaces. Now the second resident. This one is responsible for about 80% of the confusion. It's called an acrocordon. You might know it as a skin tag, but most people just call it that annoying little thing on my neck. Here's the fundamental difference that changes everything. An acrocordon has absolutely nothing to do with a virus. You didn't catch it. You can't give it to anyone. Nobody gave it to you. It's not an infection. It's your own skin, growing in a way it wasn't supposed to. Structurally, it's incredibly simple. A tiny stalk of collagen fibers and blood vessels wrapped in a thin layer of your own skin. It hangs. It moves when you touch it. It's soft, not hard. Its color is usually identical to your surrounding skin or just slightly darker. And it almost always shows up in folds. The neck, the armpits, the groin, under the breasts, the eyelids. Anywhere skin rubs against skin or skin rubs against fabric day after day, year after year. That friction piece is real. But here's the part that surprises most people. Friction alone doesn't fully explain why some people get dozens of these while others get none. The deeper story is happening inside your body. There's a hormone called insulin. Its job is to act like a key. It unlocks your cells so that sugar from your bloodstream can enter and be used as fuel. Now, if you've spent years eating a lot of refined carbohydrates, the white bread, the sugary drinks, the processed snacks, your cells start ignoring the insulin signal. They become resistant to it. So your pancreas panics and produces more and more insulin to compensate. The result is chronically elevated insulin levels circulating through your body. And here's where your skin pays the price. Insulin isn't just a key for sugar, it's also a growth signal. When it's constantly elevated, it tells skin cells to divide and multiply more than they should. And those little fleshy tags? They're one of the places where that excess growth shows up. This is why skin tags are so strongly associated with people who are overweight, pre-diabetic, or dealing with metabolic syndrome. Those tags on your neck might look like a cosmetic issue, but they can also be your skin quietly sending you a message about what's happening in your metabolism. That's worth paying attention to. There's a third growth worth mentioning because it trips people up. Seborrheic keratoses. These are the ones older adults call age spots or age warts, even though they're neither infected nor truly warts. They look like someone dripped brown or black wax onto your skin. They have a stuck-on appearance, like you could peel them off if you tried. They're rough and sometimes slightly raised. They're completely benign, they don't spread, and they're incredibly common after 50. But because they can look alarming, people panic unnecessarily. And then there are moles. Moles deserve their own category, not because most of them are dangerous, but because, unlike everything else we've discussed, a mole is the one thing that requires professional eyes, not just self-assessment. Any mole that changes shape, develops an irregular or uneven border, shifts color, becomes multiple shades within the same spot, grows quickly, itches persistently, or bleeds without being scratched, that mole needs to be seen. Not tomorrow, not next month, as soon as you can get an appointment. Now that you can tell these things apart, let's talk about the removal methods that go viral every few months online. Because some of them aren't just ineffective, they cause real, lasting damage. The most popular one for skin tags is tying a thread around the base. The idea sounds logical. Cut off blood supply, tissue dies, falls off, problem solved. And if you were in a sterile surgical suite with proper equipment and a medical professional, a version of this principle is actually used. But you're not. You're standing in your bathroom with a spool of thread and a pair of hands that have touched your phone, your door handle, and your face today. What actually happens is this. The thread creates pressure necrosis, deliberate tissue death. That dying tissue in an unsterile environment is an open invitation for bacteria. The most common result is cellulitis, a skin infection that causes redness spreading outward from the site, warmth, swelling, and pain. It requires antibiotics. In people with diabetes or poor circulation, it can become severe fast. And beyond infection, when the tag finally detaches, it often leaves behind a wound that doesn't close cleanly. The result is a scar that's more visible than the original tag ever was. You went from a tiny, fleshy bump to a permanent mark. That's not a trade most people would agree to if they understood it up front. The second method people try is cutting. Scissors, nail clippers, razors, whatever's sharp and available. The skin tag seems so small. How hard could it be? Harder than it looks. Skin tags have a blood supply. When you cut through them without proper vessel management, you bleed. And that stalk is often closer to nerves and lymph vessels than it appears. The pain is significant. The bleeding can be surprisingly hard to stop because you're not applying controlled pressure the way a practitioner would. And again, your scissors are not sterile in any clinical sense. Wiping them with rubbing alcohol reduces surface bacteria, but doesn't achieve the same result as autoclave sterilization. You're introducing bacteria to an open wound on your body. The third popular approach is chemical burning, using apple cider vinegar, lemon juice, tea tree oil, or similar acidic and irritant substances. The logic is that the acid will eat away the growth. What it actually does is burn. Acids don't read labels. They don't know to only affect the tag and leave the surrounding skin alone. So you end up with a chemical burn on healthy skin, irritation that can last for weeks, and in some cases, a dark mark left behind where healthy skin was unnecessarily damaged. There's also a subtler danger with all home removal methods that rarely gets discussed. You're eliminating a piece of tissue without anyone ever examining it. The vast majority of these growths are exactly what they appear to be, benign. But in rare cases, something that looks like a simple tag can be a form of skin cancer in its early, most treatable stage. When you remove it yourself, that tissue is gone. No one can analyze it. You've destroyed a potential warning signal. Now let's build the practical protocol. Let's separate this by what you're actually dealing with. If you have common warts on your hands or feet, there is an over-the-counter treatment with real clinical evidence behind it. Salicylic acid. You'll find it at any pharmacy in gel, liquid, or patch form. It works by chemically peeling the wart layer by layer over time. It's slow. This is the part people skip past, so let me say it clearly. This treatment takes weeks, sometimes 2 or 3 months. If you quit after 10 days because you don't see results, the treatment didn't fail. You stopped it. The correct way to use it goes like this. Every night, soak the affected area in warm water for 5 to 10 minutes to soften the skin. Then take a disposable nail file, not one you'll reuse, and lightly buff the surface of the wart to remove the top layer of dead skin. Do not file until you bleed. You're just removing the outer dead layer so the acid can penetrate. Throw the file away after. Apply a small layer of petroleum jelly to the healthy skin around the wart, creating a protective barrier. Then apply the salicylic acid product directly to the wart only. Cover it with a bandage. In the morning, wash the area and leave it alone until the next night. Repeat every single night. If the surrounding skin becomes raw or very red, skip 2 or 3 nights and then resume. You will not see the wart vanish suddenly. What you'll see is gradual reduction over weeks, the texture becoming less raised, the surface softening. That's the treatment working. For skin tags, external removal is genuinely a case where professional care is the cleanest answer. A dermatologist can remove small tags in under 10 minutes using cryotherapy, which is a precise freeze, or electrocautery. No open wound, minimal risk, no scar when done correctly. But here's what most skin tag content never tells you, and it's the part that actually matters most. External removal is just maintenance. It handles what's already there. It doesn't address why your skin keeps making them. And if the underlying environment in your body doesn't change, new ones appear. Then you remove those. Then new ones appear. You're on a treadmill going nowhere. The real intervention is metabolic. If elevated insulin is driving the production of these tags, then the most powerful thing you can do is reduce the insulin stimulus. This means cutting down the foods that spike blood sugar most sharply and most often. White bread, white rice, pasta, sugary drinks, processed snacks, anything made with refined flour or added sugar. These foods send your blood sugar up fast, which triggers a large insulin response, which creates the growth environment for skin tags. Replacing them with foods that digest slowly, vegetables, legumes, whole grains, lean proteins, healthy fats, produces a gentler blood sugar curve and a gentler insulin response. Add movement. Even walking 20 to 30 minutes after meals has a measurable effect on blood sugar and insulin sensitivity. Your muscles act as a glucose sponge. The more you use them, the better they absorb sugar from your blood without requiring a flood of insulin. Sleep matters more than most people realize, too. Poor sleep disrupts the hormones that regulate appetite and blood sugar. And people who consistently sleep under 6 hours show measurably higher insulin resistance. Same goes for chronic stress. Cortisol, the stress hormone, interferes directly with insulin function. These changes don't make the tags you already have disappear overnight, but they create an internal environment that stops producing new ones and improves your metabolic health in ways that go far beyond your skin. There are situations where no amount of home care is appropriate, and knowing them is just as important as knowing the protocol. Any growth on your face, especially near the eyes, should be handled only by a professional. The skin there is thin and delicate, and the cosmetic stakes are too high for experimentation. Any growth on the genitals requires a medical evaluation before anything else, because certain strains of HPV that affect that area carry different implications than the strains causing hand warts. If a growth is bleeding without trauma, itching persistently, growing rapidly, changing color, or developing irregular borders, stop all home treatment and get it seen. These are signals the skin sends when something more than a benign bump is happening. If you have diabetes, peripheral vascular disease, or a compromised immune system, then home removal attempts carry higher risk than for the average person. Professional care only in those cases. And if you've been faithfully treating a wart with salicylic acid for 3 months without any response, a dermatologist has access to in-office treatments that work when over-the-counter options don't. So here's where we land. These growths on your skin are not a mystery. They're not dangerous by default, and they're not something you need to wage war against with thread and nail clippers. What they need is the right identification, the right response, and for the skin tag specifically, an honest look at what's happening inside your body that might be creating the environment for them in the first place. Your skin is not your enemy. It's communicating. These little tags and bumps are information, and now you know how to read them. If this gave you clarity you didn't have before, share it with someone who's been dealing with the same thing. Subscribe if you want more content like this. Practical, no fluff, medically grounded information you can actually use. Drop a comment and tell me, did you know the difference between these growths before today? What have you tried in the past? I read every one. See you in the next one.